So febrile seizure is a seizure which occurs in children with fever because of any reasons like a viral illness or a bacterial infection like common cold, urinary tract infection, ear infections, etc. It occurs in children from 6 months to 5 years of age. Usually the risk of the seizure after 5 years of age comes down, or we can say there is no risk of seizure after 5 years of age. And this febrile seizures is not an epilepsy, so it doesn't affect your child's brain development or milestones. This convulsions can occur in the form of uprolling of eyes, clenching of the teeth, frothing from the mouth, or it can be tightening of the limbs or jerky movements of the limbs. So this febrile seizures can be a simple or a complex febrile seizures. A simple febrile seizures, it lasts less than 15 minutes and it occurs only once per day, and it is usually generalized, that is all the limbs are involved, whereas in complex febrile seizures it's the other way around, where it involves only one part of the body and the seizures might occur multiple times in a day and it might be prolonged. So usually in febrile seizures the convulsion occurs because of the sudden rise of fever or a sudden high spike of fever. There's a dysregulated electrical discharges in the brain which leads to the seizures. In febrile seizures, if the child has a family history of febrile seizures, that is if the parent or the sibling had a previous history of febrile seizures, there's a slightly higher chance that they might have a febrile seizures in the future. So what to do when your child has a fever and a febrile seizures? If your child has a fever, it is similar to the management of any other fever, like giving paracetamol, doing a tepid sponging, putting on lightweight clothes and encouraging lot of hydration. Medicine called clobazam can be tried in selected cases for the first 2 to 3 days of fever, but it may not prevent recurrence of the seizures. When your child has a seizure, do not panic. Place your child on the floor and making sure that there are no harmful objects around. Any clothes around the neck or the chest should be removed. If possible, one of the parents can try recording the video so that it's easier for your doctor to understand what type of a seizure it is. Do not try to put any objects in the child's mouth, or do not try to feed your child or give any sips of water or give any syrups to the child at the time of seizures. Do not try to put any metallic objects in the child's hands because he may injure himself. If you already have a midazolam nasal spray as prescribed by your pediatrician, you can put the nasal spray and take your child to the nearest hospital once the seizures have subsided. Thank you.